Hello everyone, today we will see the ligaments of the liver. So there are mainly 5 false ligaments. The false ligaments are nothing but the reflections of the peritoneum, and 2 true ligaments which are mainly the remnants of the fetal structures. The false ligaments here are falciform ligament, superior layer of coronary ligament, inferior layer of coronary ligament, right triangular ligament, left triangular ligament, and the lesser omentum. The true ligaments are ligamentum teres hepatis and the ligamentum venosum. So coming to the false ligaments, that is the first is the falciform ligament. So this is the falciform ligament. It is sickle shaped and it is having a attached margin, that is convex attached margin, which is attaching with the anterior abdominal wall and also to the diaphragm. Whereas lower concave attached margin, it will come down and attaches to the liver and separates the anterior surface into right and the left lobe. And it is also having a lower free margin which will run from the interlobular notch and goes and attaches till it extends till the umbilicus. So the contents here of this free margin will be the ligamentum teres, para-umbilical vein, and the accessory portal system of the saphe. Next, coming to the superior layer of coronary ligament. So this shiny part and this dull area, what we can see here, you can see the reflection. So this is the superior layer of coronary ligament. So here it is mainly made up of a single layer of peritoneum which comes from the anterior abdominal wall and falls back and reflects onto the liver. So here it is mainly a parieto-visceral layer. It runs along the superior surface, comes towards the right side and ends at this level, whereas when we see on the posterior part of the liver, here the inferior layer of coronary ligament will come and it also extends till the right side of the liver. So both will join here to form the right triangular ligament. Here the inferior layer of coronary ligament is also reflection of single layer of peritoneum. Here it covers the liver and goes back and continues with the anterior surface of the right kidney. So here it is a intervisceral layer part, and the superior layer of coronary ligament, inferior layer of coronary ligament, where they are joining to form the right triangular ligament. This area we call it as the bare area of the liver. Coming to the left triangular ligament. So the left triangular ligament, the peritoneum only which is covering the anterior surface of the left lobe and posterior surface, both will come together, and here at the left corner they will join to form a bilaminar fold which we call it as a left triangular ligament, which again further goes and attaches to the diaphragm part. Here also the right coronary ligament will further attach to the diaphragm or to the anterior abdominal wall. Posteriorly, when we see here in this part, so there is this is the caudate lobe and the quadrate lobe. The area between the caudate lobe and the left lobe of the liver, this fissure is the fissure for ligamentum venosum, and here the lesser omentum will be lying. So the lesser omentum is mainly made up of 2 layer folds of peritoneum. Both the layers will come and dip inside here, and anterior layer is on the mainly on the left side and posterior layer is on the right side. So the anterior layer of the lesser omentum is mainly formed by the greater sac, whereas the posterior layer is formed by the lesser sac. When we see here properly, the lesser omentum attachment is like a J-shaped, inverted J-shaped attachment will be there. So vertical limb will be in the fissure for ligamentum venosum, whereas the horizontal limb, it will surround the porta hepatis part. So the anterior layer of this peritoneum is mainly formed by the greater sac, whereas the posterior layer, which is towards the caudate lobe, is mainly formed by the lesser sac. The lesser omentum here, it mainly extends from the liver to the lesser curvature of the stomach, and also to the proximal 1.25 centimeter of the first part of the duodenum. So the free margin, which is towards the duodenum, it mainly which forms the anterior wall of the epiploic foramen. The contents here of that free margin will be the hepatic artery, portal vein and the bile duct part, whereas along the lesser curvature we will be seeing the branches of left gastric and the right gastric artery. So those will be the content of the lesser omentum part. Coming to the true ligaments, here in the fissure for ligamentum venosum, this is the ligamentum venosum, which is nothing but the remnant of obliterated ductus venosus, whereas this fissure is the fissure for the ligamentum teres. So this is the ligamentum teres hepatis. Here this is nothing but the remnant of the obliterated left umbilical vein. So these are the ligaments of the liver. Thank you.